good evening, everybody. I'm Priyanjali from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is the common chronic skin condition in India. According to study conducted across four Indian cities, reveal that more than 80% of the population present skin color heterogeneity on the face, irrespective of gender and age. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin more susceptible to pigmentary disorders. It occurs mainly in women, which is 90 to 90% and 10% of all ethnic and racial groups. Around 20 to 30 of 40 to 65-year-old women present facial melasma. Melasma and hyperpigmentation generally is ignored as a sign of aging and often is misunderstood as a skin condition. Melasma sufferers has been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustration setbacks in treatment. To avoid all these hassles and to keep you informed today, we are here to know more about the management of melasma from our expert. So let's connect today with our skin expert, Dr. Apoorva V Bharadwaj, live from Bangalore to talk on melasma and its management. Dr. Apoorva V Bharadwaj, MBBS, MD, DVL, FRGUHS dermatosurgery, is a Bangalore based dermatologist with a strong focus on dermatosurgery, hair transplantation, lasers, and biologic therapies. She is the founder and chief dermatologist at Routines, a graduate of Lady Hardinge Medical College, Delhi University, and MS Ramaya Medical College. She has completed advanced training in dermatosurgery through FRGUHS. Dr. Apurva is proficient in a wide array of procedures, including acne scar surgeries, vitiligo grafting, actively involved in dermatology research, and has multiple peer reviewed publications. Passionate, skilled, and research oriented, she is known for her evidence based, patient centric approach. Today, we are privileged to have her here with us, and she will be sharing her insights on melasma and its management. We extend our heartfelt gratitude to you, Doctor, for joining us today. Without further ado, over to the topic. What is melasma, Doctor?
So thank you for that wonderful introduction. So coming to melasma, see, it is like a very common pigmentary condition where we see these brown patches coming up symmetrically, like on the cheeks, on the forehead, on the nose, or on the chin. So it's most commonly presents like that. So that is what we say is melasma.
So, Doctor, like any other condition, identifying the condition becomes a challenge. So, what about melasma? How does one identify in the early stage that this is melasma? Also, um, it somehow replicates freckles. So, how can one differentiate between freckles and melasma, and how does one identify in the early stage?
Okay, see, so melasma has like a very typical in the face where it affects is very typical. It usually comes on the cheeks and it usually comes very symmetrically, or it can come on the nose, on the chin, on the upper lip, on the chin, on the forehead. So wherever it starts, it usually starts almost always on both sides equally. And in the very early stage, yes, like you said, it can look like freckles. At this point, it is very difficult for the patient themselves to know whether it is just a freckle or melasma. So at this point, visiting a dermatologist would be better because we have to check with a dermoscope and see what is the pattern of pigmentation in the skin, how deep it is, and in what pattern it is progressing. And based on that, we can differentiate between a freckle and a melasma. The freckle, freckle versus melasma treatment is kind of different because the freckle is not going to progress in its size, but melasma initially what looks like freckles can slowly keep progressing over a period of time and then start looking like a big patch of pigmentation on the skin. So that is
Right.
also why it's very important to catch it early.
Mm-hmm. Right. Now speaking about hyperpigmentation, doctor, how does one differentiate between hyperpigmentation and melasma?
So, see, hyperpigmentation is an umbrella term. Hyperpigmentation means increase in the brown in your skin due to any
Right.
reason. It could be any reason, like the acne has healed and left behind a brown spot. That is also called hyperpigmentation. or you go out into the
Mm-hmm.
sun, you get tan. Tanning is also a type of hyperpigmentation. So melasma is a type of hyperpigmentation. So hyperpigmentation itself is not a disease. There can be like many causes for hyperpigmentation, out of which melasma is one of them.
Right. Now, as you mentioned, cause, doctor, what can be the cause behind this melasma?
So melasma is, see, the most important kind of a reason for melasma to get triggered is sun exposure. But the same sun exposure cannot cause melasma in everybody. So like that person needs to be genetically prone for it. Like they have to have genetics, like the family history or like any like a hormone imbalance, which makes them genetically prone to develop melasma once they are exposed to sunlight. So you would have typically, like we typically see like women in their pregnancy developing this because of the hormone imbalance, or during their menopause, or when they're on oral contraceptive pills. So usually when there is some amount of hormone imbalance, that is when the melasma gets triggered. Again, they need to have some sun exposure during that time also. That can further trigger melasma in a more like aggressive way. So
Right.
usually, otherwise
Now,
even thyroid problems can also trigger it.
right, right. Now, coming back to the topic once again, identifying the condition becomes a challenge for all of us. As I was mentioning earlier, doctor, uh, I see a lot of women nowadays when they are in their late 50s, probably. They are in the late 60s. Nowadays, we see a lot of awareness towards skin. We see men even doing skincare. I have never seen my father doing skincare when I was young. Also, my mom, she nowadays, she would every now and then give me a call and ask about skincare, because there is so much awareness in the market regarding skincare. There are products, hefty amount of products, and people are also getting to see such changes. Now, we see a lot of women in their late 50s who now realize that they have such patches on their skin. And I know plenty of them who has no idea that this is melasma. So they somehow probably think that it's a liver condition, which is somehow flaring up on the skin. And now, because they have a lot of time, because children are grown up and they have some time for themselves. So maybe they are thinking about their skin, and they often think that the products in the market which are available nowadays, that can somehow clear up the mark, or uh, yeah. So, doctor, is it possible that those products can somehow, treat melasma, or can those chemicals or over the counter medications which are available in the market, can they clear up the mark as they think?
See, actually, the problem is that whoever with these kind of patches approaches a pharmacist directly, or like any kind of a medical
Mm-hmm.
store, or even their neighbor, like whoever they approach, the immediate answer is a steroid cream or a steroid combination cream, okay, of some sort. And that, see, the steroid cream will work, okay, it will kind of
Mm-hmm.
clear up the patches, but in the background, it is damaging the skin so badly. But by then, these women have already gotten addicted to that cream because it is giving them a nice glow. And now they are not able to stop using that cream. And the moment they stop, their skin starts looking even darker. And now they've made their problem much worse by using the steroid cream. So I wouldn't recommend anyone to take over-the-counter treatment for melasma. See, sunscreens, moisturizers are different, but melasma is like, you don't want to trigger it more by doing the wrong treatment. Because it is, as it is, melasma is a little chronic condition which requires a lot of maintenance, so you don't want to make it worse by using the wrong creams. So using the right
Right.
creams, then definitely it can clear up or almost clear up, and then it can be maintained very well. But we need to use the right products for it.
Right. Right. A lot of people, doctor, they don't even know whom to visit if they are having such an issue. They visit the nearest parlor, or they will watch some video online and they'll get the kind of things which are available in the market, or they'll visit the pharmacist, as you have mentioned earlier. So the right person for such kind of flare up on your skin, or sudden change on your skin, or any difference on your skin whenever you notice, is a dermatologist. Guys, please visit your nearest dermatologist. We are trying to spread awareness through this medium, so that we can reach out to maximum number of people. And please do not use any sort of over the counter medications based on any advice or any word of mouth or any video. This can be only and only harmful for you. The right person for you to have a glowing skin and a beautiful skin and beautiful hair is a dermatologist only. Moving ahead, doctor, towards the next question. Um, a lot of people, whenever we see any people having skin condition, we have a fear in our mind that we might get it as well. So, is melasma contagious?
Absolutely not. So melasma is not an infection. It is not contagious. Yes, it can be hereditary. Okay, so if your mother or your sister, your aunt had it, it's possible that you might get it out of purely genetics, but not
Mm,
contagious.
right.
And
Because
also
you mentioned that.
to add on to your previous note, I just also want to tell that not to go to cosmetologists, or like
Mm,
aestheticians, because that they don't like they can't treat melasma as a whole, because what people mostly don't know is chemical peel is not the answer to melasma. Chemical peel, in fact, is the last option for melasma. Any kind of procedure, laser, chemical peels are all the last option for melasma and never the first option, because creams itself can give a very, very good effect. And only if creams don't work, then only we proceed to procedures. Whereas visiting a cosmetologist or an esthetician, they may not know this and they may directly jump to doing procedures which can, worsen the skin over a period of time.
right. Doctor, just to know, what is even a cosmetologist?
Sorry.
What does cosmetologist mean? I mean, we speaking from the industry, we know that there is no such thing. They are not professionals. Can they even prescribe medicine?
See, the thing is, some of them have an MBBS background. Okay, they have an MBBS degree and then they go on to do an aesthetic sort of a fellowship, or which are not usually recognized. Okay, so the thing is, they still as an MBBS doctor, they are okay to treat like basic skin conditions, but they may not be
Right.
knowing the complete nuances of treating like a complicated, like like further progress in how to
Mm-hmm.
tailor the treatment for each patient. That becomes very difficult. So, and it is
Right.
like it is not a wholesome picture that they're trying to see in a patient. So, I wouldn't
Mm.
recommend. I wouldn't recommend and those with an MBBS background is at least something, like there are people without any completely a different background, say BDS or Ayurveda, homeopathy. So even they, if they do the aesthetic or cosmetology kind of a fellowship, that is completely invalid.
Right. Right. Now, moving ahead, doctor, we were talking about genetics earlier. Um, what if the person who is watching us right now, she can see such resemblance in his or her family? So, any prevention they can take in order to stay away from it?
So, the best way is for sun protection. Okay, sun protection is like I cannot stress on this enough, the importance of sun protection in melasma, because in melasma their skin is extra sensitive to sunlight in those areas alone. So they need to apply sunscreen like every 2 hours, every 3 hours. I'm not exaggerating this, but every 2 to 3 hours application of sunscreen is very important for people with melasma. As opposed to people who don't have melasma, even if they apply sunscreen once a day, maybe they will get away with it. But not for people with
Mm,
melasma. So they can prevent it and even like reduce it to a large extent with just their sunscreen application. And other than that, the hormone imbalance, it's like that is something which is to an extent in our control. So weight fluctuations or oral contraceptive pills, any early diagnosis of a thyroid issue and treatment for it. So those are the things which can help to prevent it. So that can be done.
mm, right. Now, let's talk a little bit more about sunscreen or how important is sunscreen and the rest of the things. Coming back to sunscreen, doctor, we lot of people does not know how to choose their sunscreen. A, they do not know how to use their sunscreen. Also, as you mentioned, they should use it every 2 to 3 hours. Also, they don't know the right amount of sunscreen they should use. Can you elaborate about all of these?
So there are different sunscreens based on the type of skin that each person has. So there are separate like oil-based, oil skin sunscreens, dry skin, normal skin. So all of this is not just a marketing trick, because the ingredients are actually different when it comes to each skin type. So if a person with say dry skin uses, if a person with say oily skin uses a sunscreen which is recommended for dry skin, they will get acne. Okay, and they will not want to use a
Mm,
sunscreen ever again because they got acne from it. So they need to use a proper sunscreen for their skin type. That is one. And second thing is, I already told you like how often they need to reapply the sunscreen. Now, for someone with oily skin, when they're reapplying sunscreen, they have to kind of at least wipe the excess oil off their face before they apply the next layer. If possible, to wash the face with just water, that would be better. Like just rinse it off with water and then reapply your next layer. And the next is how much to apply is like usually like what the sun says is like 2 fingertips. Okay, so that is
Mm.
also okay, but you need to use the entire length of the fingertip. Okay, the entire length of the finger of the like the sunscreen quantity is required for the face and neck, or you can even take like this entire one block. Okay, covering the entire 2 fingertips, one entire block you can take and apply it for the full face, neck, and ears. And even after all this, physical protection from sun is also even important, like using an umbrella or a scarf or a hat or any like a cap or something like that. That would even go a longer way than just depending on the sunscreen alone.
Right. Well, we are talking about melasma today, but somehow, if everybody follows these tips, even if you're not having melasma, it can be beneficial for you. Using sunscreen on your daily life is good. Now, doctor, there is also another question for the people who wants to use sunscreen and who has not much idea about using sunscreen. Is it equally important to use sunscreen even if they are indoors?
Yes, so sunscreen has to be used even when indoors because we have to protect our skin from the filtered light from windows and even from the infrared light coming from all our devices, like the blue light, visible light, everything which is coming from our devices, our TV, our mobile screens, and especially for women who cook or even men who cook for that matter. So whoever is in the kitchen, like who stand in front of the kitchen flame, that heat generated from the flame can also cause a lot of damage in our skin. And for melasma prone people, they have to wear the sunscreen even before they enter the kitchen. So that becomes very
Hmm.
important. So it is even while you're indoors.
Right. Now, doctor, let's know a little bit about how we diagnose the patients who initially come to us and then they have such patches on their skin. What is the first step we take in?
So see, the thing is for diagnosis itself, it is just by examining like if they have the visible patch itself, you don't even need to. It's visible from a distance that it is melasma. Rarely we have to
Mm.
make sure that it is melasma depending on what treatment they have already taken, what creams they have already applied. The picture might have slightly changed. So there may be like a dermoscope. Very rarely a biopsy is required to confirm the diagnosis itself. And once we know that it is melasma, the treatment will be mainly focused with creams. So sunscreen will form a major part of their application. Like throughout the day, they need to apply sunscreen starting from the time they wake up till almost 4 p.m. in the evening. And then post that in the evening is when we focus more on getting the pigment to reduce with other set of creams.
Mm-hmm.
And if they use only the pigment reducing creams without using sunscreen, there is no point because again next day when they go out into the sun, the melasma is going to recur. So the sunscreen alone will not reduce the pigmentation, but it has to be used in combination with the other creams, and that's when they'll get the best result. And even this takes at least say a good 8 weeks to 12 weeks to see the results. So they need to be very
Right.
consistent with their application, and they
Mm.
cannot expect
Mm.
any dramatic overnight kind of results. And along
Right.
with this, yes, there are other options also available, like say, like few tablets are there to reduce the pigment, or definitely like last line procedures are there, like kind of chemical peels or lasers. All of that are also there down the line to consider if someone is not responding adequately to just the creams.
Right. Now, let's go one by one. Firstly, doctor, you mentioned about the creams which are available in the market. I mean, the creams which we suggest our patients for the treatment. So, well, the sunscreen and the cream. Apart from these, doctor, are there any other options which the patient can opt for in case if they want a rapid result?
Yeah, so we can combine certain tablet medications as well, like oral medications as well, can be combined,
Mm-hmm.
which contain, for example, citronellxamic acid works very well for melasma. So that can be combined for someone who's not, say, whose health is not contraindicated. Like if the other person, like we have to rule out a few things before giving these medications to people. Not everyone
Right.
is, a suitable candidate for this. That is an option.
Mm-hmm.
Say apart from this, like for a more rapid this thing, we can consider say again the same chemical peels. Okay, but the thing is the melasma pigmentation is not just superficial. It can go into almost all the layers until like the deeper like
Mm-hmm.
the dermis layer also. So until there, we cannot treat it with just the chemical peels. Chemical peels work only to an extent, to only a few upper layers of the skin. And if you have to go further deeper, then laser toning can be combined. So this is how we would combine the procedures in a patient who's following all the instructions for the cream applications and who wants a little bit more rapid response. Then yes, we can do this way.
Right. So I believe this is why you mentioned about the consistency. I mean, whenever we are talking about skin, we know that it's all about consistency. There is, as you clearly mentioned, that there is nothing called overnight change, and overnight change will not be permanent. It will fade away just like it came. So you have to be consistent with the treatment. A lot of patients, whenever they don't get result immediately, they feel like अरे ये काम नहीं कर रहा है, let's try another dermatologist, or let's visit another doctor, or an expert. So you have to be consistent. You have to be. Also, doctor, is it possible that whenever we are suggesting such medications or creams to the patient, there is a slight flare up initially and then it heals? Can this also be possible? Because I've seen in the case of skin, I've seen a lot of patients where initially the skin is seen to be flaring up a little, and then slowly and gradually it goes through the healing process. So is it also possible in the case of melasma?
It is see that issue is more common with acne and less with
Mm-hmm.
melasma. But yes, it can happen
Okay.
sometimes with melasma as well, depending on what
Mm-hmm.
cream you're using to get the pigment out. So sometimes what
Right.
happens is that the pigment all builds up in the upper layers. Okay, so that time
Right.
like it can. And the thing is, what we're doing is we're asking them to apply the cream all over the face and not just on the patch.
Mm-hmm.
So the rest of the
Mm-hmm.
skin, brightens up much faster than the patch
Right.
itself. So immediately the
Right.
patch starts looking more evident on the skin. So it's not like the patch itself is getting darker. It's just that the rest of the skin is getting more bright. So it's more of like a contrast which makes the patch more evident now. And most of
Mm-hmm.
the times, people start noticing what is wrong in their face only once they start taking the treatment. So now they notice that
Right.
problem more. So they feel like it is not, they notice it every day. They notice even the micro changes every day. So they want
Mm-hmm.
kind of a more dramatic response now that they've started noticing it.
Right. Right. So
So
in
other than
such
that, flare
cases,
itself is very less common in melasma.
right. Right. Well, I believe in such cases, the best thing you can do is stay connected with your expert. I see a lot of people losing touch with the doctor just because they did not see any change, and something has gone wrong with the skin. They do not feel like going to the expert. That is not the solution. That journey will never end. You have to discuss the problems, and you have also to discuss the progress, the kind of changes you are seeing in your skin. You have to discuss it with your expert in order to get the best possible result. Well, we are talking about such basic things today, which we tend to do in our regular life. Somehow we do not feel like accepting such things, but we are doing. We are going to the parlor wali didi and we are getting our skin treated. This morning I have seen a video where there is drastic change in the before and after. Probably those videos are edited. You cannot believe such videos. You have to understand it. So please do not follow social media. Please discuss it with an expert, a certified expert, before doing anything with your skin. Moving ahead towards the next question, doctor. Um let's talk about the risk factors. Are there any risk factors when we are talking about melasma?
Risk factor itself with melasma, no. Melasma is a completely benign condition. Even if you don't treat it,
Mhm.
it is going to just stay as a pigmentation on your skin alone. It cannot harm you internally in any way. But if you are going to try risky treatments for melasma, then yes, it can damage your skin more. So it's the risk is only from the what treatment you take and how you do the treatment. Like there are some creams which the doctors also recommend, but it has to be used only for a certain period of time and you have to go back to them as a follow-up and then that's when the cream has to be tapered and stopped off. But if the patients continue to use
Right.
such creams for a long time on their own, then that can definitely harm their skin more. So it's only the treatment related sort of damage that can happen by patients not following the instructions properly, but melasma itself has no harm for the patient.
Right. Well, that brings a sign of relief. There are certain myths which surround melasma as well. A lot of people I've heard from who has said that melasma, the cancer can get formed from melasma. Is it possible or is it just a myth,
No,
doctor?
absolutely not. It cannot turn into cancer. No.
Right. So need not worry about that. The main issue when we are talking about melasma is the the kind of reaction which you see in people's eyes, the social non-acceptance, or a little psychological self-esteem hampers. I think those are the kind of things which we get to see. But with right treatment, everything is possible. Doctor, what about those people who are watching us right now and who can relate to today's topic? Um, does melasma has a permanent solution? I think this would be the question from all of them. Can melasma be treated completely?
See, melasma, you have to see like it's that you cannot cure it, okay, because the skin, like it's just there. Like your genetics are going to make your skin brown, and there's a new layer of skin coming up every 6 weeks. So your every new layer of skin is going to act in the same way as your previous layer of skin. So you need to maintain. You can only control melasma, but you cannot completely cure it because it is in your genes.
Hmm.
So with consistent use of creams and consistent follow up, then definitely melasma can be maintained very well. So I have seen people getting a clear skin. Okay, otherwise
Hmm.
even if not a completely clear skin, at least an almost clear skin where only few resistant patches remain on the skin, which is still forgivable. So, it
Hmm.
can reach to that stage, and that itself boosts a person's confidence a lot, and that has to go very consistently.
Right, right. Well, yes, consistency is the key. You have to be consistent with your skincare, and you need to be touching with the doctor. Doctor also, we know that कि हम जैसे खाते हैं वैसे हम दिखते हैं. We have heard a lot of people saying that you eat good, you look good. Anything, any dietary habits which one need to maintain when they are suffering from melasma?
So, like I mentioned, sun protection is the best way to go forward in melasma. So,
Mm-hmm.
there are certain foods also which will help internally for sun protection, and all of these are which are rich in antioxidants. So, I would say, foods which are rich in vitamin A, C, and E. So, that is vitamin A will be all your colored fruits and vegetables, like say tomatoes, carrots, beetroot, or pomegranate. Then vitamin C from amla or any of the citrus fruits, and like the vitamin E comes mainly like from say pumpkin seeds or sunflower seeds, and even consuming chia seed water, so green tea. So all of these are very rich in antioxidants, and especially vitamin A plays a very important role in sun protection and just in general like a skin enhancing sort of a vitamin, which we can get from our own diet. And drinking a lot of water, so that also keeps the skin healthy. So a hydrated skin always responds better to treatment. And so these are some of the things that yes we can do in our diet to kind of improve our sun protection and reduce the sun damage.
Right. Also, doctor, what about skincare? You mentioned that we do suggest our patients some creams and kind of if they require any kind of medication alongside the creams or the lotions. Uh, can they continue their regular skincare regime alongside the medication or the lotions or the creams?
Now it depends on what their regular skincare regimen is. Like it depends. Like if they have an acne-prone skin and if you have to treat the melasma as well, then we can the dermatologist itself will suggest the whole kind of a skin routine for them because especially like if they're doing some home remedies or any other Ayurvedic or homeopathic kind of skin remedies, and that cannot go side by side with the melasma treatment. But if there is any other skin issue to be addressed, then the melasma treatment will also be tailored in such a way that it fits everything. So that is
Right.
not a worry for the patient. Like they can just tell the doctor what all they are using and whatever best that can be continued or it has to be discontinued. That can be discussed with the dermatologist.
Right. What about people with sensitive skin, doctor? We know sensitive skin, they have people with sensitive skin, they seem to, suffer a little more than the rest of the people, maybe. So, any difference for the people with sensitive skin?
For sensitive skin, I would say like we have to go very slow. We cannot kind of what like a improvement I would expect in a normal skin in say 8 weeks. I would give more time. I would give like 12 to 16 weeks for a sensitive skin patient because I need 1 month to understand the patient's skin itself before I jump into giving any creams, because whatever strong creams I give for a sensitive skin, it will flare up in a very bad way. And then the patient will lose trust in the treatment as well as in the doctor, so that is not what we need. And we don't want to kind of trigger a sensitive skin too much. So we have to go very slow. So there I would go with like a much milder kind of a treatment step, and it will be a very gradual step by step approach towards the improvement. But it is definitely possible to achieve improvement even in sensitive skin. But it will take little bit more patience from the patient side as well.
Right, right. Also, doctor, any other triggers for the patients of melasma apart from not using sunscreen on a daily basis? Any other triggers or any habits that can trigger?
The habits which can trigger like it's more of like say like if you're allowing any hormone imbalance to happen. So I would say like weight fluctuation. So if someone with melasma is on the higher side, in their weight, then targeting towards achieving a good BMI would be recommended, because the higher weight will always keep the hormone imbalance in a higher level, and that will keep triggering the melasma even if you stay sun protected. So I would say having a healthy lifestyle, regular exercise is very important, and even like using sunscreen when they go for cooking. That is most people like ignore it. So I would say like wear a sunscreen even when you go to cook in the kitchen. So that is something. And thyroid, to get a yearly checkup, because mostly like melasma affects women. So and women are more prone for thyroid abnormalities. So on a yearly once basis, if they can get their thyroid levels checked, that will be better.
Right. Now, quickly, we can see some questions coming from the viewers, doctor. The first question, uh, are there any specific ingredients in skincare products that melasma-prone people should avoid?
Should avoid steroid. Okay, so unless your dermatologist has recommended you because they feel your skin needs it, on your own, please don't ever experiment with a steroid. And another ingredient is hydroquinone. The hydroquinone has to be used only under a supervision of a doctor. Okay, and then only for as long as the doctor has recommended it. Never use hydroquinone based products for a longer time than which is recommended to you, because that itself can get deposited in your skin and start looking black underneath your.
I believe we have lost the connection, but we will try to get Dr. connected as we have few more questions left. It was a wonderful session already with Doctor. We got to learn a lot today about the topic melasma. And like every time we come up with a different topic, the people who are still watching us and who are still yet to come up with their questions, make sure you ask your questions in our chat box. Well, everybody, we are trying to get Doctor connected, and we're extremely sorry for the network glitch, but we are trying to get her connected. We have few more questions for today's session. People who have just joined us, make sure you watch the recorded video because today we are talking about a very important topic which affects a lot of people around us. Yes, doctor, with the question as about the products, the skincare products that melasma prone people should avoid.
Yeah, so that is mainly steroid, and hydroquinone used beyond the recommended period can definitely harm the skin. Rest of it, like I wouldn't recommend any experiments. I would never recommend in melasma, but yeah, these two products definitely to look out for.
Right. Moving ahead to the next question, doctor. Uh, the the viewer asks, what kind of sunscreen formulation is best for melasma? Physical, chemical, or tinted?
I would say like any broad spectrum sunscreen. Okay, if tinted suits you, then tinted would be best. But you need to find the right tinted sunscreen for the shade of skin. So that can be a little challenging in Indian skin. But yeah, tinted sunscreen would be the best. And physical or chemical, it's fine, not a problem. But it needs to be like a broad spectrum with at least 50 SPF and PA 3 plus.
Right. The next question the viewer asks, can stress or lack of sleep trigger melasma?
Sorry, can stress or
Lack of sleep.
lack of sleep? See, like unlikely, maybe indirectly. Like if stress or lack of sleep triggers your hormone imbalance, and if a hormone imbalance triggers melasma, then yes, but not directly.
Right. Well, the next question is there a seasonal pattern to melasma worsening?
If seasonal, sorry, I can't hear.
A seasonal pattern to melasma worsening.
Yeah, it can definitely worsen in summer season. It can definitely worsen in summer, and it can worsen once you're gone. Once you have been on a a vacation to a place where it is really sunny, especially like a beach vacation. Definitely, or like spending just one day out in the complete like in the sun. Like say you went shopping, like street shopping, or you went to an amusement park. So these are the things which can trigger melasma, and immediately it will start looking worse in the next few days. So, like for this kind of a seasonal kind of a flare up in melasma or like a vacation type of a flare in melasma, I would also recommend like these sunscreens which are available in tablet forms. So there are oral sunscreens which are available that we recommend to patients who are going on the vacation or in the summer season. Just in those 2 months they can take it. Even glutathione comes in a tablet form, so even this can be taken for like say 2 to 3 months around this time, or when it is they have to actually start it 2 weeks before the the expected exposure time, and they need to continue it throughout, and then again once they come back from the vacation they need to continue it for a week or so, and then they can stop it. So this protects them from sun damage to a larger extent, along with say the sunscreens and all of that.
Right. Well, Meenal asks, doctor, should people with melasma avoid waxing or threading?
No, not necessarily. No.
Right. And I believe this is the last question for the day. Raju asks, is melasma more difficult to treat in men?
No, not necessarily. It is the treatment approach is the same in men and women both. It is just that for men we have to use a little stronger creams because their skin is a little thicker, so we might
Hmm.
straight away go on with like a little bit more aggressive kind of a treatment. Otherwise, there's not much difference. Like it's the same.
Right. Well, we had a wonderful session, doctor, today. Before we take a leave, any take home message for our viewers who has watched us so far?
So I would say like don't lose hope if you have melasma. Don't lose hope even if you have treated, even if you have tried the treatment before. Maybe there's something that you haven't tried yet. But don't try it on your own. Always go to a dermatologist. Get like a good, sort of an understanding of your condition and what suits best for your skin, and then follow it consistently.
Well, that was the expert advice for today. And that was Dr. Apoorva V Bharadwaj for us. Thank you so much, doctor, for your valuable time. It has been a very informative session for our viewers, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more such sessions, stay connected on our beautiful Spotless Skin page. You all stay safe and take care.